back and let's continue our class. We continue speaking about the conversation between these two people, Dr. Dixon and Mr. Bloomfield. And so now I would like you to focus on the form that Dr. Dixon is going to complete about his patient. Doctor asks several questions to clear out the condition of the patient, and he completes the form, and you can see that the form consists of several parts. They are titled like PC, HPC, and PMH, and family history. So do we remember the meaning of these abbreviations? So what do these abbreviations stand for? Who remembers PC? What does it mean? Hello?
This is for the patient. He put what he feeling, her name, history of his father and mother. Yeah, doctor?
This is about, yes, for example, family history. Yes, there is information. But we were speaking about PC at our previous classes. So during the first and the second week, what does it mean? What do these letters stand for? I mean, what is the word? What are the words just behind the letters? So actually, do you remember the title of Unit 1? What is it called?
It's
okay, so we don't remember. Actually, the Americans call it chief complaint, but the British in Britain, in the United Kingdom, it's called presenting complaint. Presenting complaint, yes, this is why the patients come to the doctor and they speak about their condition. And so if this is the presenting complaint, the first part, starting with number 5, for example, here on this form, this is HPC. So there is H, history of presenting complaint. And PMH, this is post-medical history, post-medical history. And yes, there's one more abbreviation in the first part. It starts with the SO, breathlessness. This is complains of. So the patient complains of something. Well, and just to understand the information better, we need to focus on the meaning of some words. Here there is contributory. So where is it? It's here, line 9, contributory causes. Just contributor means helping to cause. And precipitants, factors which cause something. Some precipitants that go before something. Well, now I'm going to turn on the recording, and so please listen to the conversation and complete the gaps with the words that you understand the doctor and the patient use. Well, so make some notes on paper and then we'll discuss. Well, I'll turn it on.
Listening to.
Can you hear?
Yes, doctor.
Okay.
yes.
No.
Listening to.
Good morning, Mr. Bloomfield. My name's Dr. Dixon. I'm a locum GP standing in for Dr. Wright. What can we do for you?
I've been having some problems with my breathing.
Can you tell me a little bit more about this?
Well, I keep getting breathlessness and wheezing in my chest. It all started about 3 weeks ago, and I've been coughing a lot with it. Some white phlegm. I thought it might be a cold coming on, but then after about another week, I started finding it more and more difficult to catch my breath.
Right. So you've had the wheezing and the breathlessness for roughly 3 weeks.
Yes, give or take a day.
And do you get these bouts of wheezing and shortness of breath every day?
No, they come and go.
How frequently do you get them?
The first week there was only one, I think, and then they started getting worse, 3-4 times a week. It's not being able to get my breath that's really worrying.
And so the attacks, have they increased in the past 2 weeks?
Yes, they're much more frequent.
Okay. When do the attacks come on?
At any time, but they seem to be worse at night and in the morning.
Have you noticed any change in the severity of the attacks, especially in the morning?
Yeah,
Do they wake you up at night?
about 3 times a week.
I see. You been off work at all?
No, but I nearly didn't go in yesterday.
Was that the worst so far?
Yeah.
And have you had anything else with it?
I've felt a bit tight across the chest.
Any pain with it?
No, just tightness.
Are you aware of anything that triggers the attacks?
Like what?
Dust, feathers, new carpets?
No, I can't really say I am.
Okay. Have you had any infections recently, like flu or sore throat or chest infection?
No, not for a long time, except this.
And what about medications? Are you taking anything?
No,
No, aspirin?
no,
Are you doing any exercise? Jogging, for instance?
no.
What about pets? Do you have pets at home?
No. But my neighbours have a cat, but I don't see it that much.
Everything okay at home?
Yeah, things are fine.
And what about work? I see you're a civil servant. Any stress or problems at work or anything like that?
Work's been getting me down recently.
In what way?
Well, there's been a lot of changes going on recently, and I suppose I'm a bit anxious, what with the mortgage and that.
And this has been getting to you?
Yes, more and more.
I see. And does the wheezing, etc., continue over the weekends?
No. When I come to think about it, it doesn't.
Okay. Some general questions. Have you ever had anything like this before?
No, never.
Do you have other illnesses? High blood pressure, diabetes, or heart problems?
No, nothing like that. This is the first time I've been ill in my life.
Has anyone in your family had anything similar?
No, not as far as I know.
What about eczema? Anyone in your family with that?
Both my sister and my mother have it.
Well, have we completed the form? Yes, no? Hello?
Yes, doctor, we finished.
So I would also like you to pay attention to the following information. So, yes, what I mean that on the second slide, so there are some facts that are also given in the conversation. And the question is about what Mr. Bloomfield says about the following things. So things that trigger attacks, infections, medications, physical activity, pets, problems at work, and mortgage. I would like you to listen for the second time just to check so whether we have completed everything, and also the information about these things, just to understand the details more. Now, just for the second time.
Listening 2.
Good morning, Mr. Bloomfield. My name's Dr. Dixon. I'm a locum GP standing in for Dr. Wright. What can we do for you?
I've been having some problems with my breathing.
Can you tell me a little bit more about this?
Well, I keep getting breathlessness and wheezing in my chest. It all started about 3 weeks ago, and I've been coughing a lot with it. Some white phlegm. I thought it might be a cold coming on, but then after about another week, I started finding it more and more difficult to catch my breath.
Right. So you've had the wheezing and the breathlessness for roughly 3 weeks.
Yes, give or take a day.
And do you get these bouts of wheezing and shortness of breath every day?
No, they come and go.
How frequently do you get them?
The first week there was only one, I think, and then they started getting worse, 3-4 times a week. It's not being able to get my breath that's really worrying.
And so the attacks, have they increased in the past 2 weeks?
Yes, they're much more frequent.
Okay. When do the attacks come on?
At any time, but they seem to be worse at night and in the morning.
Have you noticed any change in the severity of the attacks, especially in the morning?
Yeah,
Do they wake you up at night?
about 3 times a week.
I see. You been off work at all?
No, but I nearly didn't go in yesterday.
Was that the worst so far?
Yeah.
And have you had anything else with it?
I've felt a bit tight across the chest.
Any pain with it?
No, just tightness.
Are you aware of anything that triggers the attacks?
Like what?
Dust, feathers, new carpets?
No, I can't really say I am.
Okay. Have you had any infections recently, like flu or sore throat or chest infection?
No, not for a long time, except this.
And what about medications? Are you taking anything?
No,
No aspirin?
no,
Are you doing any exercise? Jogging, for instance?
no.
What about pets? Do you have pets at home?
No. But my neighbours have a cat, but I don't see it that much.
Everything okay at home?
Yeah, things are fine.
And what about work? I see you're a civil servant. Any stress or problems at work or anything like that?
Work's been getting me down recently.
In what way?
Well, there's been a lot of changes going on recently, and I suppose I'm a bit anxious, what with the mortgage and that.
And this has been getting to you?
Yes, more and more.
I see. And does the wheezing, etc., continue over the weekends?
No. When I come to think about it, it doesn't.
Okay. Some general questions. Have you ever had anything like this before?
No, never.
Do you have other illnesses? High blood pressure, diabetes, or heart problems?
No, nothing like that. This is the first time I've been ill in my life.
Has anyone in your family had anything similar?
No, not as far as I know.
What about eczema? Anyone in your family with that?
Both my sister and my mother have it.
Well, so let us summarize what we've learned about the patient and read so the words that we've written in the first part about presenting complaint. So Yana, what did you write there?
Yes, teacher. So I write the wheezing, coughing, and flaming with white flame.
And yes, so but in number 1 and number 2, what did you write? Will you repeat, please?
Wheezing and coughing.
And in number 3?
I didn't get it. I tried to hear it productive, but I didn't know the complete of it, and with white flame.
White phlegm, it's okay. I think productive cough here. And so
It's
yes.
theme of the coughing, not number 2, so I didn't get.
Wheezing, you've written wheezing. I think it's just breathlessness. So we should repeat breathlessness and wheezing.
It was
And,
written
Yes, it's given here on the first line. So the patient complains of breathlessness. This is his main complaint. And 3 out of 52, what do these numbers stand for?
I don't really.
So
I
this is
didn't really
about,
hear that.
we understand 52 weeks a year. So out
Yeah.
of 52, he's been
So
ill
3 times.
for 3 weeks. For 3 weeks. Well, and the history of presenting complaint. Yosif, can you read this part of the form, please? Yosif? Yosif, hello. Are you here? Minus. Well, let us just listen to Swat. Swat, are you here?
Yes, I'm here, miss.
Please, the history of presenting complaint. What did you write there? Starting with 5 up to 10. Attacks worse when? Swat.
When he goes to work,
Well, and number 6, then?
I'm not sure. I tried to find the answer for this, but I couldn't really find.
What did you write in the other gaps here in this part?
Okay. So for I wrote for number 7, the cough wakes the patient about 3 times per
3
week,
times
and
per
then
week.
yes. And other symptoms is chest tightness.
Okay.
It contributes cause he doesn't have I'm not sure
Okay.
about this one.
Well, who can help us with number 5 and number 6?
Can
I
I
can
start?
help teacher.
Yes, what is it? Yes. Who's
Can I,
speaking?
doctor?
Yes, please.
I think it gets worse at night and morning.
And in the morning. Well, and yes, so this is tightness. What about number 9? Contributory causes. So when he speaks about something that can cause these attacks, so the patient says no. That is why we should write no known precipitants here in 9. And so history suggests. So what does the history suggest? So I mean, if the patient has.
Eczema.
Sorry, repeat please.
He has eczema
Eczema.
because his sister has it.
Is eczema the problem with lungs?
I'm not sure how to pronounce the history.
Well, and if the person has tightness in his chest and so productive cough with white phlegm, so it shows us that this is the problem with lungs. And so can we think of any diseases connected in this respect here, connected with lungs?
Maybe it's pneumonia.
Sorry?
Maybe it's pneumonia.
Pneumonia, okay. Yes, possible. So, or it can be asthma and other diseases. Okay, post-medical history. If we ask Noor, please. What
Which
can
number, Dr. 12?
11.
No history of high pressure or yes, and number 12, her mother and sister have eczema.
As for 11, no history of previous attacks. So that well, that was said by. We should just write here. And good. And if we answer these questions, is Aisha here?
Yes,
Aisha?
doctor, here.
So,
Yes.
what do you remember about these factors? What did the patient say about this?
What's the
Mhm.
disease he feel?
No, I mean, can you answer the question? What does he say about things that trigger the attacks? What are they?
No, he said he didn't have any infections
Mhm.
and taking any medication. And he also said he didn't take any medications. And then his neighbor has a pet. He has a cat. And the things that trigger the attacks.
Okay, so he doesn't see the cat much. He doesn't see physical jogging exercise, physical exercises. Well, what about problems at work? Ramil, are you here?
Yes, teacher.
So what do you remember about problems at work?
Problems at work?
Right.
I think teacher, he had a tightness in his chest. Mainly he has breathlessness, he had coughing, wheezing.
Ramil,
Yes.
it's just about work. It's not about his condition. We have already discussed it. But when the doctor asked him about problems at work, what did the patient
Yeah, problem at work. I didn't get you the first time. So he said yes, it might be because he has like let's say exhausting and stressful job, and he think working too much, maybe like a hard work he's doing. That's why.
What exactly he says that there's been a lot of changes at work, and so that is why he's stressed, right? And the last question here is about mortgage. Do we understand the meaning of this word mortgage? Who knows what it means?
Miss, mortgage is the payment of a house over a long period of time.
So this is yes. So when if a person just buys a accommodation or house and doesn't have enough money, he takes a loan from the bank. Agreement, signs an agreement between. So with the bank, just to get the necessary sum of money, and then he pays the money back to the bank plus the bank interest. This is mortgage. And so that is, and he's worried about whether he's be able to pay the money back because of the problems at work. And this is one of the reasons why he's stressed about what he's stressed about. And so he's worried. Well, that is the question here. Why are the past medical history, family history, social history, and drugs and allergy history important? So you see that the doctor asked a lot of questions. So about all the details of the patient's life. Why is it necessary? Who can answer this question? Yes, Ramil.
So teacher, there are various diseases, let's say we call them genetic diseases that passes from one generation to another generation. And that's why family history is important to know whether his dad or mom, whether siblings and other relatives have that type of disease. Maybe from them, it passes to the patient. And about drugs and allergy history. So drugs, as we know, some drugs affect some patients negatively. not everyone can have the specific drug, because as you know, they can have some allergies. That's why they have to know if he has some allergy to drugs and other stuff.
Mhm. Yes, and also some medications have
Can I add it?
a lot of side effects. Yes, please. Mhm.
Yes, teacher.
Because genetics plays a role. Each of us has things like his family, because all of us, we have the same genetic tracts.
Exactly, right. And knowing the social history is also important because sometimes the conditions the people live in just influence the health of people, and we'll be speaking about this today. Well, very good answers. Thank you. And if we move to the next slide, here is the information about signs and symptoms. Let us just differentiate these two words, understand the difference between this, the meaning of these two words. Like, let us agree that a sign is an indication of illness that the doctor sees, but which is not apparent to the patient. So a sign is to a doctor. A symptom is what the patient notices himself or herself. So sometimes signs can be classified as symptoms and vice versa. And if we move here to the next slide, here is the description of one of the conditions of a patient. And we should decide whether these are signs or symptoms. Some, maybe both of them. So, well, signs and symptoms are here, and we should say whether they are signs or symptoms. Let us listen to Abdul Rahman. Hello.
Yes, miss.
So will you comment on this, please?
Yeah, a blocked nose would be considered a sign. Raised temperature would be considered a symptom. Tender over sinuses is also considered a symptom. Headache worse on bending, that's a sign. And a runny nose is also a sign.
Well,
Actually, teacher, I don't agree in some of them.
Which don't you agree with?
Fourth and fifth, they are the symptoms, teacher, because patients can notice them. Mainly patients notice them.
Which one? I've missed it.
Teacher, fourth and fifth one, the last two. I mean,
number 3 and 5. Yes.
No, number 4 and 5, teacher.
Number 4 and 5.
Yeah.
Look. So symptom is what the patient notices. Sign is what the doctor knows. So headache, worsen bending, this is symptom, of course, because so the patient feels it. The same as runny nose, blocked nose. So sometimes people do not understand that the temperature of their body is raised. So it can be a sign for a doctor. Sometimes they do feel about this, and it can be a symptom. As for tender over sinuses, the patient feels some kind of discomfort, but the doctor understands the location of this condition, so it can be the sign. So, and as for condition B, so let us also do this kind of classification, whether these are signs or symptoms. And let's listen to Afs.
Yes, okay. Okay. Raised pulse. This is a symptoms. Recent vomiting. This is it's a sign. Dehydration. is symptoms, and abdominal tenderness sign, and crampy abdominal pain. I think it's a sign.
You think so? Well, I mean that symptom is what the patient can see. Well, crampy abdominal pain. So only the patient feels this. That is why we say this is a symptom. Or vomiting, diarrhea. It's obvious to the patient that he has this symptom. This is symptom. Sometimes people can understand that their pulse is raised. It can be a symptom. Sometimes they don't realize it. So they don't mention, they don't tell the doctor about this. And the doctor feels, and it is the sign for a doctor. Dehydration is also there. Sometimes people do not understand that they lack of water, but only the doctor can see this, and this is the sign for a doctor. And abdominal tenderness also. Why is it important to differentiate between signs and symptoms? This is because the doctor should write everything, the patient's complaints and also the signs that show that can tell the doctor something about the condition of the patient. The question, which diseases and signs are symptoms, the signs and symptoms might relate to? I mean, condition A and condition B. What is the disease? Yana, condition A. You as a doctor, how can you understand what's wrong with the patient?
So, because he has runny nose or blood nose.
And what is your diagnosis?
He has a flu, cold flu.
Yes, yes. So is tender over sinuses. This is sinusitis, right? And
Yes.
it's cold. Well, and condition B. Yosif, are you here?
Yes.
Okay. What do you think of this condition? What is your diagnosis, doctor?
The first one, doctor.
No, I mean all these signs and symptoms, they show us, they tell us about the one disease or several diseases. What are they? What is the disease?
Crampy abdominal pain.
Your medical diagnosis, what is it? Pain is a symptom, right?
Right.
So, and you as a doctor, what would you say? What would you write? What kind in the form? So the form that was like here, history suggests what? Number 10. What kind of disease this suggests? Any ideas? Who would like to help us? Help the patient. Yes, Swat, please.
It's probably food poisoning.
Maybe.
Because of the vomiting and diarrhea, abdominal pain.
Teacher, maybe gastritis.
Gastritis also possible. Or can it be appendicitis?
Possible.
Yes, yes.
Also possible, yes. So the problem, there are a lot of causes, problems that cause just pain in the abdomen. Well, yes. And if we think of any signs and symptoms that we would expect to see in a patient with pneumonia, so what are they? signs and symptoms in a patient with pneumonia. What are they?
Can I talk about the signs?
Yes, please.
Okay, so it have a cough, also fever, sweating and shaking chills, also shortness of breath.
Mhm, mhm. Yes, okay, great.
And-
Swat, please.
Miss, I would like to add also they can have like tightness in chest, and usually the cough would be drier and would have like a sound coming from the chest as well.
Mhm, mhm. And also wheezing, right? Is possible, like
Yes.
in the previous conversation. Okay, yes, you're right. And yes, Ramil, what would you like to add?
So it could be also teacher rapid shallow breathing. It could be nausea and vomiting, especially in children. It will be confusion, especially in older people, and it will be loss of appetite, low energy and fatigue.
Mhm. Yes. So what about temperature? Did we mention temperature? The raised temperature, is it raised?
I think yes, it's raised teacher temperature.
Okay, yes. So, well, yes, very interesting. So these are the condition with, what do we call this kind of system in the body? It's not digestive system, it's not cardio.
Respiratory system.
Which one? Will you repeat, please?
Respiratory system.
I didn't get it.
Teacher, respiratory system.
Okay, maybe. So I'm not
You
sure
mean
about.
lungs, yes, teacher.
Ah,
Yeah.
yes,
Yeah.
where lungs are involved. Mhm. Okay, good. So now, yes, we should pause for a break and